In this video, we're going to discuss lumbar spinal stenosis, which is a condition that affects the back and often causes pain in the leg. The classic presentation of these folks is they have both back pain, but also pain that goes down both legs. That is worse with standing, walking, anytime they're in the upright position, and is relieved with sitting. You often see these folks at the grocery store. They're usually bent over their shopping cart simply because they find more relief in that position as opposed to being perfectly upright. So the first step is when somebody with stenosis presents to PT is making sure they are appropriate for physical therapy. And what we use comes from the low back pain clinical practice guidelines. I'm going to pull it up. So these are the big ones that we look for. So back-related tumor, like if the patient had like a history of breast cancer and we're worried that it's metastasized to the lumbar spine. So these are some of the questions that we ask. Here's another one, quad equina syndrome. The big one's urinary retention, infection. We're going to look for fevers, chills, night sweats, compression fracture, usually in older people, long-term use of steroids, history of trauma, abdominal aneurysm. So these are some of the things that we look for to make sure that the person is appropriate for physical therapy. A lot of times patients get hung up on this and want medical imaging such as an MRI to make sure nothing's wrong. However, we are trained to ask the right questions to figure out if there is suspicion of something else that will require an outside referral, such as to a spinal surgeon. If you have one of these, it doesn't necessarily mean that you have the condition. Like, for example, if you're over 50, you don't automatically have a back-related tumor. However, our suspicion does go up, and if it crosses a certain threshold, the patient does get referred to another provider. So next is we want to determine if the patient's leg pain is worse with walking and standing, if that's a lumbar issue or is that a vascular issue. The way we determine that is with vascular issues, we'd expect it to be worse with all physical activity, and especially with more pain, the more the intensity exercise is. So with people with vascular claudication, which is just pain in the legs from issues with the blood vessels, we would expect walking uphill to be worse just because it's more physically demanding. However, with the patient with lumbar stenosis, walking uphill should be easier since they are bent forward and thus it takes them to that relieving position. Another thing we can look at is like a biking test. See if the patient gets symptoms if they're on a bike or any sort of cardiovascular exercise where they are bent forward. If the issue is from the blood vessels, we would expect that to be equally as bad, whereas something like that usually is not painful with the patient with lumbar spinal stenosis because they are in the bent forward position. Then after that, the next step on our list is doing a neuro screen. What this entails is taking the patient's reflexes, testing their sensation, and testing their strength. What we're going to do is go through each spinal level to see if the nerves are affected to the point where they are where there's some deficits noted. The saying is that nerves are very easy to piss off, but they're hard to damage. But nonetheless, we want to make sure the patient does not have any sort of neurological loss and thus requiring outside referral. Same thing, we're also going to look at balance. Sometimes these patients have balance impairments and thus might require an outside referral if it's kind of like a neurological balance issue. And this might even be in addition to receiving physical therapy services at the same time. If there is some sort of minor like sensory issue, some weakness, it might be just a conversation that we and the patient has with a neurologist or some other specialist to kind of keep track of everything, and then continuing with PT treatments, but this varies case to case. So now it comes down to actual treatments for the lumbar spine. So I'm going to pull up a model So if you type in spinal stenosis, this is kind of the classic picture that shows up. I'm not a huge fan of this picture just because it makes it seem worse or more damaging than what it typically looks in reality. However, the patients with stenosis have the difficulty bending backwards. So treatments are going to be aimed at increasing the flexibility of the spine with the bending backwards motion. So in other words, we're trying to improve the spine's flexibility from one vertebrae to the other so that the patient has more mobility in bending backwards. In somebody with stronger symptoms, like let's say somebody's got very severe stenosis where they can't tolerate more than a couple minutes of standing, we'll actually start at the hips. So what we're trying to do here is create more flexibility of the hips bending backwards, and thus it's less natural extension at the spine when the patient's standing. I'm going to pull up another image. So, as you can see here in this diagram, what we would do is work at the hips to create more flexibility here with this bending backwards, this bone bending backwards against here. This is both at the hip joint itself and muscles around the area. And what that will do is create less resting extension at the lumbar spine. We're also in patients who have less of a tolerance we're going to work at this area above as well. This is the thoracic spine, and we're also going to try to create more extension here to offload the lumbar spine. Again, this is just a temporary approach, just for patients who have a lower tolerance for this area. But ultimately, we're going to want to do some work here to strengthen these muscles and get this part of the spine more flexible, both bending backwards. In addition to those treatments, the research has shown great results with combining aerobic activity in the bent forward position, such as a bike, a stepper machine, in addition to those physical therapy treatments mentioned before.